It's a beautiful evening here in the city of Lagos. And today I sound really excited. You can feel it in my voice. This is a radio diva with a vibe from head to toe, vibe through my body, you understand? But the vibe I came with today is very special. Like, it's a different kind of vibe, right? Because we are celebrating our day. And aside that, we've actually been celebrating since last week, 6th of May, we started the 1 week long celebration of International Nurses Week, and which it runs from the 6th of May till the 12th of May. And today is the 12th of May, which is the day of the nurses. Today is the International Nurses Day. And as you already know, I am a registered nurse and I am also a media personality. So I love to identify with my profession anytime, any day. I'll always identify with my profession because I was first a nurse before I became a radio presenter. So that is why we're celebrating today. And today is going to be really sploofic. It's going to be exciting. It's going to be scintillating. The conversation is going to be gang because I have guests in the studio with me today. For those of you who are just joining the show for the first time, you are welcome. I want to remind you my name. For those who already know, I'm never going to be tired of mentioning myself to you. All right, let me reintroduce myself again. For those of you who don't know, my name is Mario Zroyagolo, aka Roya the Radio Diva, aka the Media Nurse, aka the Thought Goddess. Some choose to call me the Queen of Microphone. And the program is Healthcare Achievers Talk Show. We celebrate the healthcare achievers. We celebrate everyone who is making impact in the healthcare industry. And of course, we can also celebrate a full professional body in the healthcare industry. And that's what we're doing with today's episode. Today's episode is actually a very special one. Like I mentioned earlier, we are doing this to commemorate the International Nurses Day, and today wraps up the entire week of the International Nurses Week, which started from the 6th of May till today, which is the 12th of May. And I am here to have a very nice conversation with two professional nurses who are here with me in the studio. I like to tell you that nurses, the nursing body generally is the bedrock of the healthcare system, because anytime, any day, be it morning, afternoon, night, midday, midnight, anytime, you're going to definitely have a nurse on the ward with the patient. Nurses are part of life. They start with you the day you were born. In fact, what am I even saying? Nurses start with you while you are even in utero, like while you are still in your mother's womb. The nurse is already with you there, during antenatal clinics and the likes. And the day you're born, a nurse is there to catch you. That's the midwife. From that day that you're born till you die, a nurse will always be there by your side to even give you the last office, even when you have gone and you don't know what is happening behind you anymore. A nurse is always there from inception till the end of life. Give us our garden of flowers. We are worth celebrating, and that's why we are dedicating this episode to International Nurses Day. So today, we are going to be looking at the theme of this year International Nurses Week, which is Our Nurses, Our Future, Caring for Nurses Strengthens Economies. Our nurses, our future, caring for nurses strengthens economy. Who cares for the carers? The nurses are the carers, the nurses are the caregivers. So who cares for us? Who checks upon us? Who ensures that we are earning good money at least? Let's even start from there. It's very important for the society to care about us so that the economy can actually move, because nurses are important. We play a very key important role in the society, in the healthcare system generally. But today I'm going to be driving the conversation from the angle of some of the challenges that face the profession, especially in Nigeria. And let me quickly introduce my guests. Today we have these two very powerful nurses from NCI. They are actually representing Nursing Conception Initiative. And by my left here, I have Nurse Samuel Oluwafemi Joseph. He is a registered nurse. And by my right, I have Nurse Bayowa Benedict Omotola. He is also a registered nurse. Nurse Samuel, how are you doing today? You're welcome to Healthcare Achievers Talk Show on Wash FM.
I'm doing very well today. Firstly, I would like to quickly correct that I'm a student nurse.
Okay, you are a student nurse. Okay.
So not so, because we are going to be talking about an important topic here. So
of course.
We're not going to that.
Oh, all right, good.
I'm doing great, and I'm always happy to join in conversations like this, because these conversations are very, very important to the profession, and nursing is a very, very noble profession.
Sure, it is.
Yeah, we want to come in with all the energy, and as a male in this profession, it's been a great ride so far.
I can imagine. You're welcome, Samuel Oluwafemi Joseph. So I also have Nurse Bayowa Benedict Omotola. Bayowa Benedict Omotola, how are you doing today?
Oh, I'm doing fine. I'm doing great. I really want to thank Wash FM for bringing me to the show, and it's great to be on the show today. Thank you very much.
All right. Thank you very much. All right. So let's dive into the conversation of today. So we are celebrating the International Nurses Day. So what is the significance of this celebration to the profession as a whole? So let me start from Bayowa.
Well, I would say the International Nurses Day is a beautiful profession. It's actually the day in particular, which is May 12th, actually marks the birthday of Florence Nightingale, who is the mother of modern nursing.
I'm sure a lot of people don't even know who Florence Nightingale is, so I would like you to dwell on that once more.
Florence Nightingale, although before Florence Nightingale came into the picture of nursing, nursing already existed. But then she actually gave a proper vision and structure in that sense for nursing, and that structure has been what future nurses and like nurses have been following, and that is why nursing has been progressing till this day. And so she's actually a great individual in the profession, and that's why we celebrate her, and we also mark the International Nurses Day on her birthday.
So today happens to be her birthday. So let me talk to Samuel. Bayowa talked about the fact that Florence Nightingale was the one that gave structure to the profession. So we refer to her as the mother of modern nursing, right? The profession was existing before her, but she gave it a whole different meaning that we all emulate today. So I'd like to ask you, do you think that the structure that Florence Nightingale left for us is what we are still practicing till date, especially from the angle of how the profession is being practiced in Nigeria?
No, I don't think we are still using the structure. I just think that there has been innovation from when we had Florence Nightingale. She came with the concept of let's care for these people. Let's tend to their wounds. Let's give them personalized care. But then when you're not going to what we are practicing now in nursing, we have research that has been done. We have innovation. We have different specialties in nursing, because nursing is not just about just doing those practicals, just doing those things that you want to do to the wound or to the dressing of a wound. It's more of the person you're looking at, the person you're treating, the patient you're treating, the holistic care of the person. So you're looking at the mental aspect of the person. So those other specialties, as they come into play, and that they only come into play because research has been done and people have tried to see how they can increase or improve the level of care we give to our patients over the years. And more researches, more innovations, and I don't think we are supposed to say the same thing from there.
Okay, so from your own point of view, you believe that what we have now is actually better than what Florence Nightingale left?
Well, it's better.
I see. All right. So but looking at the theme of this year's International Nurses Week, talking about improving caring for the nurses to improve the economy, so how does that work? Let's look at it from the welfare of nurses, the professionals themselves, and let's also link it to the recent Japa syndrome, the fact that so because I'm actually driving somewhere, but I want to pick it up from the theme. So what would you say about the way nurses are being treated? speaking of the welfareism, the professional standard. We are talking about Nigeria now, because this is home for us and we can only speak from the home front. So what do you think? I'd like you to go first, Samuel. Then I would like to also hear that same response to that same question from Bayawa.
Okay. From what I've seen, when I participate in world rounds and what I've seen from other nurses on the world, I think it's not up to that part when we want to talk about how they are being cared for in other countries. That's why we have this Japa syndrome going around, because nurses are very, very integral to the healthcare system, and it's only those that are in the healthcare system that actually realize this. And we have people that are making these policies, and some of them are not really, really inclined with the healthcare system, and they don't even know these things. So, in terms of welfare and reason, in terms of how they treat the nurses, because this also, it reflects on the way the nurses actually treat their patients. Because nurses themselves, if you're as a person, as a nurse, because they're also individuals, and if they're not being cared for, if their mental health and all those things are not being cared for, so it affects the way they deliver the amount of care they want to deliver to their patients. And that's when we have people talking about they have one issue with a particular nurse who knows this, knows that, and this. So I just think in Nigeria, we are still far, far, far behind in terms of welfareism for nurses, and that's why we still keep on having issues with Japa syndrome.
Bayawa, what do you think from this angle too?
All right, from the Japa syndrome aspect, I think there are a lot of factors that are leading to this Japa syndrome. One, the kind of policy we have as a country, that we do not, the policies do not cater for nurses in particular, nurses' safety in particular. Now, when we talk about the aspect of quackery, now you can see a registered nurse probably moving on the road, and probably a quack moving on the road, and they want to try to the community is trying to equate them to each other. By the time they are blaming the nurse in quotes for what has happened, for a mishap that has happened, then they blame it on all nurses. That is actually a bad effect on nurses.
It rubs on everybody. Everyone in the profession.
And
yeah.
So it is not safe for me as a nurse to still want to continue to remain in that country. So I probably have to move where there are better policies that protect me and can kind of stop that kind of happening. So salary based, the remunerations are poor. The remunerations are poor for nurses in the country, and I think that's why, because even if you have the passion to care, the money is also part of what you look at.
Money is also very
money
important.
Is very important. So that's another factor that is affecting the profession in the country. We say the health of nurses would definitely rub on the health of the people in the country. And so I think those factors are important as a profession.
Yeah. So, but speaking of the health of nurses, if you ask me, I think a lot of nurses in Nigeria are really being overworked. Number one, in public health sector, we have a very reduced number of professionals who work there currently. In fact, before now, they used to be short-staffed. So now that Japa has even increased, the short staff is now raised to power 2. So the question is, are they even replacing those that are leaving? Do they still employ more nurses as some leave? Do they replace them? And what are they giving them to really encourage them to stay in the profession? I can count up to 5 nurses that I know personally who left the profession already. I was almost at the verge of also leaving until I now found a way to marry it with my passion and say, okay, I can still run everything together. But I know a lot of nurses who have left the profession to pursue other areas of interest because of the fact that they are not well taken care of, in quotes. And when we talk about caring for the professional, it's a big umbrella that has so many other things under it. And that would lead us to the issue of quackery that he mentioned, which is actually one of the subject matters I would like us to really discuss. So we'll be talking about some of the challenges facing the profession in Nigeria, and which quackery is one major challenge that we have, and we need to look for ways to prefer solutions to them and create more awareness in the society so that people can know the difference between who a professional is and who a quack is. Samuel, what are some of the challenges you feel the profession is really battling with in this part of the world?
Number one, I would say quackery, and another one is the poor perception people have towards nursing profession itself. Because
The perception.
and that's something that's not it didn't start today, it didn't start yesterday, not even when I was born. I think it's something that has even started since when Mollywood started making movies about Mollywood, and you start having things like the way they portray nurses as subordinates, or the way they portray the kind of uniforms and all those things. And so I think those are one of the things that actually affect the profession. And it's not doing justice to what the profession is all about. It's not. And another one is policies that are in place, and policies that affect the welfareism of nurses, policies that affect how patients care, how patients should be cared for in Nigeria. Policies on things like health insurance. We don't have enough let me say enough systems in place for people to be able to get treatment. And we not have people now patronizing, now resorting to quackery, because they are
Quackery.
patronizing people that could easily get them those things that they need. So I think that's basically all one of the problems I feel like affects the profession currently.
When you're talking about policies, the first thing that came to my mind is how many policymakers do we actually have there who are nurses?
Nurses.
No, really, is that not a very good question to ask? Like,
it is.
how many nurse senators do we have? How many nurse House of Rep members do we have? Even in states, how many nurse commissioners do we have? How many nurse House of Assembly members do we have? How many nurses do we have in politics, in leadership, in finance, in agriculture, in media and entertainment? All these, we have so many sectors of the society that actually drive the economy, that drive the society. So if we don't have our own people being represented in some of those fields, we might not really see the change that we really want to see. Now, this is not just me asking questions and you answering. This is us having a conversation, because I am a nurse too, and it's our day. So we are having a conversation. And that is my own take when it comes to the issue of policy making that you mentioned. Bayowa, would you like to say something about this too?
All right. I think Samuel has mentioned a lot of factors affecting us as a profession, and I think talking on the policy again, the Nigerian Constitution is even not the full force of the constitution is not even on quackery. We don't talk about quackery in the profession. I think the fine for when they apprehend quacks is probably 200 naira in the constitution.
You can imagine.
So it's not
Ordinary 200 naira.
and we've not even gotten to the place of even apprehending them. Talk less of now prosecuting them and probably setting the bill of 200 naira. So it is actually poor. And if for the full force, for them to be able to understand the full force of the situation on the ground, I think we actually need nurses in that line of profession. We need nurses as members in the house to be able to spearhead that conversation that
Exactly.
this needs to be reformed, and please let's find something to do about this. So it's actually important.
You see, that's one of the reasons why I love what Nursing Conception Initiative is doing. I know both of you are from Nursing Conception Initiative, yeah? I love what NCI is actually doing with the quackery, anti-quackery campaigns and awareness and all that, using every means and platform to actually, create more awareness in society. But speaking of awareness about quackery, I would like us to really help inform the society right now on this show as we are right now. Who is a quack? Because they need to know. Please, let's speak it from that angle. Who wants to go first, please? The people are listening and they need to know. Today is our day. So let us help them to understand who a quack is and who a registered nurse, like a real professional, is.
All right. I think I would like to go first.
Okay, please, let's have you, Bayowa.
So a quack is someone who did not undergo a formal training to be a nurse. Now, a formal training in the sense that you need to the international Council of Nurses, ICN, has said that a nurse, a professional nurse or a registered nurse must be someone who has gone through formal training, either a school of nursing or a university, an accredited university who offers nursing. That's Bachelors of Nursing Science. Those are the two criteria, and also must be licensed by the Nursing and Midwifery Council of that particular country.
True.
So if you are going to be a registered nurse in Nigeria, you must be licensed by the Nursing and Midwifery Council of Nigeria. If you're going to be in UK, you must be licensed by the Nursing and Midwifery Council of United Kingdom. So those two criteria, you must have a formal education. And you must be licensed.
Those
are the two.
Of course, it's the formal education that will not lead to the licensing.
Exactly. And so those who go to hospitals, private hospitals, to say, okay, so doctor is teaching me how to be a nurse. That is not who a nurse is. A nurse don't go to private hospitals to learn how to be a nurse. You go to a university or a school of nursing to undergo the formal training on how to be a nurse. After rigorous trainings, different institutions, you go on postings to different clinical postings to different institutions, continue to learn, write the Nursing and Midwifery Council exam. You need to pass it and you need to be licensed as a professional nurse. So that's when you can be called a registered nurse.
Thank you very much. And nursing is heart and science. So while you undergo that training, you are getting the experience of the scientific aspect of it and the heart aspect of it. So Samuel, what do you have to say to who a quack is? I know he has said it all, but I would like you to add something to it.
Okay, I think the past few months there's been some ways I've been hammering on from the work against quackery that we had NCI, and that is Nurse Adubo.
Nurse Adubo.
I'll try to come home. When we
in English, that's nurse in the street, Abby. Auntie nurse at the back of our house.
Yes. When we start feeling feverish, or when we're at home and you're coughing and anything, you just be like, let's go and call that nurse, that's nurse in the
Abby.
And I don't want to use the word nurse because these people are not nurses. They are quacks, and there is nothing like they are untrained nurse, because a nurse is a trained person, like Nurse Motola mentioned. A nurse is a trained personnel. So how do you identify them is that they are quick to give treatment. A nurse is not quick to give treatment. A nurse wants to understand how you're doing overall, because sometimes the headache might not be because there's an illness there. It can just be because you are stressed and you just need to sleep. The way you are feeling, the nurse is particularly looking at your whole state, not just what is happening to you right now. And that's how you differentiate a quack from a nurse. And a quack again is probably going to give you subsidized rates of treatment. So they are telling you to bring this amount in the hospital. Don't worry, I can get one or two. I'll mix one or two to you. And they want to do that. Another thing again is that they'll try to give that treatment as fast as possible. And as a nurse, we understand that in the healthcare system there is multidiscipline. Like as a nurse, you're not the one that will diagnose a patient. You're not the one that is going to do the carry out the testing. So you know that, okay, if the person is at all has symptoms of malaria, right? What you want to do is let's confirm that. Run a test. But a quack won't do that. A quack is just saying, oh, it's catarrh, oh, it's headache.
They're always so quick to diagnose.
Let's just jump to.
You can imagine. So I want to believe listeners are already getting the difference now, because it's becoming clearer and more pronounced, So a quack is so quick to diagnose you, even without testing. As they just see you, it's as if you have seen everything that is doing you. Say, it's malaria. Yes. Oh, it's typhoid. Even if you did not do any test, you understand? And they would be so quick to say, oh, this is the treatment I want to give you. And they want to give you that treatment. And if you ask me, I think it's just like they practicing try and error thing. Because what if what they are treating you for is not actually what is doing you? And then they now compound the whole situation, and the matter now become yam and pepper, scatter. You understand?
We have a lot of cases of that.
That's where I'm driving now. Please tell us some of the cases, because people need to know.
I can't go into details, but then we have a lot of cases like that. Cases who I exacerbated to the current situation. They now bring it to the teaching hospital.
Mm.
Like we have.
Okay, you are on the field. You are a clinical nurse, yeah? Okay.
So I've worked. Well, I'm still a student. I'm currently in my fourth year second semester.
Okay,
Then,
but you also practice by on the side,
definitely. So we've seen situations whereby this because the truth is Nigerians are impatient. They are very impatient.
Very, very.
And that's why that's why they continue to patronize these guys
Quacks.
themselves. Yeah, quacks. So it's because we are impatient. Because when we come to the hospital, they tell us, okay, wait, we cannot just give you medication now. Let's run tests. Let's do this. To actually see what is going on with you. But then no, and Nigerians don't want to spend 3 hours. Although we understand that the waiting time in hospitals might be a lot longer.
You know, sincerely, sorry to cut you short. Telemedicine is helping us with that now.
Yeah, okay, yeah, definitely. Yeah, because like I can also see that a lot of hospitals in Nigeria we are incorporating telemedicine. Yes, and so that makes sense. So but then Nigerians don't want to wait. They don't want to see. They just expect, okay, give me injection, give me drug, let me go home and do this. And when the situation probably is just typhoid, like if it's actually diagnosed properly with test, you can actually get it solved and you can go home. But then typhoid gets to intestinal perforation, actually
peritonitis and everything.
And so there are a lot of situations that I've seen that is just, if you can just come to the hospital, let them do the proper thing, and you go home, you get treated, you go home. But then by the time they bring you to the hospital, is a whole lot of different situations, and it's actually painful.
I can imagine. So, Samuel, what do you think we can do? What's the solution? Because we are creating awareness, but it looks as if our awareness have not reached, Abby. Yeah. So, what do you think we can do?
Okay, I think one of the things that we can do is to build conversations on, and from what because I'm always asking the questions about why do people not visit the hospitals? Why do they not patronize the people?
First question: Why do people not like to visit the hospital? Why do people not want to see the professional instead? So, what are the reasons? And those are part of the reasons we need to dissect, assess, and know how to solve from that angle. Please continue.
Okay, so and you'll find out that they usually patronize. They'll come to general hospitals. They come to teaching hospitals, and these teaching hospitals are advanced hospitals. And in the healthcare system, there are levels. So you have the primary healthcare system, which is very, very close to you. I've been in the primary healthcare system. I've worked there before, and I know that coming to the primary healthcare system is one of the easiest way for you to get attended to as quickly as possible, because they'll quickly attend to you. But you see them going to general hospitals where they are having complicated cases to attend to, and when someone coming with an headache and someone with a broken leg, you won't attend to someone that has an headache. That's priority in the healthcare system.
That's triage.
So you attend to the one that has a broken leg, because the one that has an headache can still hold on for a bit. So what we can do is that we should have more primary healthcare centers in communities. So instead of you going to north side of going in your street, you know that there's a primary healthcare center within your vicinity that you can visit. And these primary healthcare centers, they are doing good job in terms of providing medications in a way that you can purchase them. Not like when you go to the hospital and they just write a list of drugs for you and just tell you to go and buy them. So primary healthcare centers will try to, is this a drug you actually don't need? So when you use these drugs finish, when you are done using these drugs, you can come back for another checkup. They tell you to come back for consultation. So if we can have more of that in our communities, we can have more of that, I think we'll solve the issue with people saying, oh, there's a long waiting time in the hospital and I don't want to go there, and they are patronizing quacks in the community. And another one is that our government needs to heighten the laws or the policies that are in place to safeguard the profession of nursing, because if we don't do that, it's going to affect the health of the citizens.
Thank you very much. Thank you very much. So speaking of solutions now, what can we do? And Samuel has talked about something that I really love so much. But before I start dwelling on that, I would like to quickly talk about the current project of NCI, Nursing Conception Initiative. There is this new movie that you guys just produced and everything, and it talks about quackery in nursing. I would like you to, Bio especially, you directed that. I would like you to talk about it.
All right. right. Thank
How
you.
does that project, how does it help the profession, especially now that we are celebrating International Nurses Day?
All right. Thank you. So, the title of the movie is on Max and it's currently streaming on YouTube. We got it released on May 6th.
May 6th is the day International Nurses
Nurses
Week
Week
started.
Exactly.
So,
So, on Max actually shows us because before on Max we had a project, also a movie, a short film called Alabere. And Alabere was about telling the public that okay, we have nurses. These nurses are nurse Adubo in quotes that okay, these people are actually detrimental to your health, to public safety. Now, on Max is actually even telling us that we even have people who are educated. It's not about the English they speak. It's not about how fine the person looks. It's not about what the person is wearing. You can have someone wearing scrub and the person is not a nurse.
A lot of them wear scrub. Forget now their scrub they find pass.
Yeah, exactly. So this movie is telling you that you can have someone that is well educated, looking beautiful,
and yet
the
is a quack.
Exactly, the person is a quack.
Wow.
And so that's what on Max is telling us about and telling us how this is detrimental to public. This is not because I see a lot of people on Twitter saying that it's because you are a nurse, you want to protect your profession. It's not even about protecting the professional. It's about public health. It's about the safety of individuals.
A registered nurse knows when to refer. A registered nurse knows when to refer. Even when the registered nurse is just at home and there's an emergency around and she probably offered first aid, she knows that, oh, the next step is to take this person to the hospital.
To the hospital.
But a quack won't do that. A quack wants to do everything and just, they want to do everything probably to get the remunerations. And one of the things that you also know is that they're always quick to give abere, like you just said, alabere. They're always quick to give injection.
And even drip.
It's like it's a lot. It's a lot. And when we talk about personal cases, I've had cases where because before I got to joining this profession. So I've got cases where I was treated for malaria, and I took treatment for typhoid. And at the end of the day, I was still feeling the same symptoms. After taking injection and countless drips, I was still feeling the same thing.
You don't tell me that the drip did not flush it. They used to say the drip will flush.
It will not flush.
It will flush the malaria and the typhoid. I've actually heard that word flush many times from the so-called alabere, you understand?
So they need to understand that antibiotics is not just antibiotics. There are different kind of antibiotics that particular to different kind of infection. And it's only those who are registered nurses, only those
who are professionals
that can identify these things. And that's why we need not to patronize. So
how do we address the fact that these so-called quacks feel we are just beefing them? When we see conversations online, they also come up to talk. It be like say they don't get associations, I don't know, but it's like you see them, they post pictures about their graduation, that they are doing freedom. You understand? Because their own is like, it's not as if they went to school, but they are learning work. So somebody that have gone to learn a trade or like gone through apprenticeship. So they will do freedom. You see pictures popping up of somebody who is kneeling down with one academic gown like that, and they are presenting certificates, and he's now smiling to camera like this, and everybody saying congratulations, you have graduated as a nurse. A supposed nurse. So they come up to actually say, oh, the professional nurses are beefing them. There is nothing that they cannot do. What can you do that we cannot do?
They say it's all about experience.
And that is also part of the mindset that the society carries. So some people in the society also believes, even if this person is not a registered nurse, he shall have experience. He has been doing this thing for a very long time. So he's sabi, he don't deliver baby well, he don't treat plenty people and all that. So what do we do when they play that experience card on us?
So I let me go first. So,
okay, please.
Okay. So one thing we'll just try to do is that, because I personally know some nurse Adubo that they've had conversations from knowing that I'm a nursing student, and they're like, how can I get into University of Lagos? How can I get the certificate? And so what we can always do is to encourage them to get a degree. You have the experience, yes, but then you still need the scientific background, you need the foundational knowledge to understand what care is, to understand how to come in, because nursing is not, we have a system in nursing called nursing process, and I don't think these people even understand what that entails, because that's a scientific, it's scientific in nature. So if you are not trained, if you don't go through the formal educational training, you will not have those knowledge. So we want to encourage them to go to college of nursing, because I know currently there are still some establishment of some new college of nursing
College of Nursing,
across
yeah.
Nigeria. So
Private and public.
try to get trained, get your degree, then you come back out and you practice, and people will accept you into the
Yes,
profession.
you'll be welcomed into the profession. And but when we're talking about encouraging them to go to College of Nursing or go to the university, there are some people who are also training them too. We cannot talk about quacks without talking about those who train them. I'd like Bayowa to say something about that, because we have gotten to the level where we've seen that even our professional colleagues train them too. Yeah. Nurses also partake in this thing. So let us not act as if the mess is not smelling in our own body too.
Right.
So let's talk about those who train these quacks, by our. What do you think about those who train them? What should we do to those ones too, apart from what we will do to the quacks?
Well, thank you very much for that question. I think I've seen a lot online too. Recently, there was a situation of someone said my guy in the pharmacy trained me to be a nurse.
Imagine.
And there was also there was one that trended, I think 3 weeks ago. I think it was even a pharmacist was saying that he has nurses he trains in his hospital, and we have people saying that doctors have trained them. We've seen we've seen videos of um, the security agencies arresting doctors who trained these quacks. And
Quacks.
so I think it runs through the profession. We should not just say, okay, it's just doctors or pharmacists that trains these people. I also say nurses too.
Some nurses actually train them too.
And so if we cannot, well, the first part of it is NNM. That's Nigerian Association of Nurses and Midwives.
Yes.
National Association of Nigerian Nurses and Midwives. And also NMCN. Well, I will not say NMCN. NMCN is actually in charge of.
That's the professional
body for licensing and this thing. But NNM in charge of nurses should spearhead this fight, because they can sue private sectors who are doing this. They can do this, and the government needs to reform the constitution to be able to apprehend. When you apprehend these people, they should be able to serve time properly. They should face the full extent of the law. And also nurses who are engaging in this kind of behavior should stop. The profession is a noble profession. Is an interesting profession. I love the profession. If you see videos of nurses outside the world, it is a profession that people actually value.
You fall in love with it.
And we should nurses in the country should actually fall in love with this profession, and we should come together to fight this head on.
Thank you. So Samuel, what do you say about those who train quacks?
Okay. All I would say is that let's crack them down, because let's do a wide crackdown, and that will not start unless those who are in the position to do those things actually take action to do them. The recent one was in Enugu, also a private hospital in Enugu, and the nurses that actually do train class. I know I've heard of I've heard of hospitals where you have them employ a registered nurse and have countless people that they train to now work on the nurse, and all those things they are detrimental to the profession, because these are the people that will be interacting with human beings, and you now start having issues and keep on coming up, and you see them being referred to teaching hospitals because their cases are beyond what these private hospitals can handle, or these lower cadre of healthcare system can handle. So what we can do is to have the let's say the people in power, the people that are in charge, people making these policies, to send out mainly memos to these hospitals that you can't do this. This is not condoned in the practice anymore. It is affecting the whole healthcare system. This is not about nursing anymore. This is about the healthcare system. We have AMR on the rise. We have, because I was in hospital recently in Lutz, and I heard about the increased resistance about 90% about the particular antibiotics, and I'm like, wow, 90% is a lot.
It's a lot,
It's a lot.
actually.
So we need a full crackdown on quackery, and those that are enforcing it, those that are at the forefront of enforcing quackery in Nigeria.
When a quack does something and society wants to describe it, they will say he's a nurse. You know, like, because even in the media, when it's being reported, it will be reported as a nurse did this. It is not a quack did this, because everybody don't seem to understand the difference between and when some people would even say it, to even crown it out, they will not say quack nurse. There's nothing like quack nurse. They will not come and say put nurse at the back of the quack again.
Or they say auxiliary nurse.
Auxiliary.
There's nothing like that in the profession.
What's the auxiliary nurse? What's that? Is it that you're a nurse or you are a nurse? So it's not, there's nothing like, is it that you're a nurse or you're a quack? Mba, it is either a nurse or a nurse. So you just have to be a nurse to practice nursing. And that is what we are clamoring for. That's why we are having this conversation on the show today. So I'd like us to say our final words now. What is, today is International Nurses Day. So what are your own final words individually to the nurses out there, to nurses in training like yourself, to aspiring nurses too, who are not yet in training, but they love the profession and they would love to be part of it. And then to the quacks too, so that they will understand that what they are doing is criminal. And then very soon, there's going to be a crackdown on them. So I'd like you to give us your final words. Let me start from Samuel.
Okay. Someone that is passionate about leadership and activism, I would just say that nurses, student nurses, those that are passionate about nursing, we should all try to engage in conversations like this and try to use our own space to active, to clamor for these changes to be made. You have your own space, whatever you are doing, anything, you are at home, you're having this conversation in your community, try to speak about this, try to raise your voices. And because at the end of the day, we can't build an healthcare system on shortcuts, and Quackery will not, it's not take the healthcare system to anywhere. It will only fall back on the profession itself. So for us to be able to fight this, we should be at the forefront. We should take up leadership positions. We should go for those places, to go to conversations, to go to conferences where these conversations are being heard, so that we can always lend our voices.
Thank you very much. Bawa, let me hear from you.
All right, thank you. Just like Samuel has said, nurses need to be grounded in other aspects, other aspects of life, like media, like leadership, like politics. Be part of the system. You cannot just at this point of our lives, at this point in the profession, you cannot just be a nurse and just be sitting at home and going to hospital and just be a nurse. You have to be a nurse who can speak in the media about situations like this, about how the profession can get better. You have to be in politics to speak, to make policies, to contribute to policies. I think currently now we have politics in government, in nursing, in government, in nursing as a course.
Yes, it's now been incorporated in the curriculum.
So
yes,
please be part of it. Ensure that you do this, and you do it well. Also, for aspiring nurses, ensure you don't don't be part of the abelling nurses you are trying to cancel out. Go to an accredited nursing institution, school of nursing or university. Apply, enroll, study, and get your license, and you'll be able to practice. And so to the general public, please don't patronize these guys. These guys will probably end you. A lot of lives have been lost through them. And so to the quacks, we are coming for you, so.
We are coming for you.
Wow.
But if you are interested in coming into the profession professionally, if you're interested in being part of us professionally, we would definitely welcome you, as long as you're ready to follow the right channel, go through the right route to becoming a professional. Go to a college of nursing, attend a university, enroll in a registered or well-recognized institution where nurses are being trained. And then you come out to get your license from the Nursing and Midwifery Council of Nigeria, and you become a registered nurse, and then we are cool. They say anything worth doing at all is worth doing well. So if you must practice a profession, then do it well. Do the right thing to be part of that profession. profession. It's really been an amazing time on the show today. We are talking about the how nursing profession can actually even improve the economy. And if you ask me, this is part of it, because if our economy will be improved in the society, we need to look at how we can solve the problems that is challenging the profession itself. And then we are still talking about the fact that even quackery can affect the public health of the society. You know, it's not just about we not liking them because they are affecting our profession. We are not beefing them, and we don't expect them to be beefing us either. But what we are trying to say is that we care enough about the health of the society. On this note, I'm going to be saying my goodbyes on the show today. It's really been a wonderful experience having this conversation with these two amazing young nurses. Thank you so much for coming on the show. We love you. My name is Mary Zorayan, aka Ryan the Radio Diva, the media nurse, the talk goddess, the queen of microphone. And I'm going to be here again for another juicy conversation. Please keep